as we dance together in the dark. There's so much love in this heart of mine. You never find they were slow dancing to their music, slow dancing, you my girl. Go ahead.
Good evening, ladies and gentlemen. It's time to begin the awards portion of this banquet. So, as you know, this evening is an extremely special one for our community. We come to honor those unique individuals who have advanced the work of our field through tireless and extraordinary efforts. At the outset, I want to express my great gratitude to Dave Nisi, our conference chair, and all the individuals who are seated on this dais because of what they have created. I can tell you, because I've been doing this since 1984, which is 35 years, and many conferences, that the extraordinary thing that happens at our initial meeting as we plan this, which is soon after the conference that Allegra Shore chaired in New York in March of 2018, that we begin, as Victoria, my better half would say, with basically a blank canvas. And then, with their creative efforts and all the committees that they compose and all of the members, we then create what has happened this conference. And it is a great, difficult, but very creative thrust, and it's our pleasure to do this. Now, we're grateful for Tracy and for all of the members of the Hospitality Committee who arranged for the excellent entertainment tonight, so thank you. Thank you. And for all of your floral arrangements, which I will tell you in advance, and you can think about this, you are able to take with you tonight if you would like. You will have to choose who does that, of course. I also want to thank the entire Mallinckrodt team. Their support throughout the years has been extraordinary. It sustained us, and it represents a long-term partnership. It's genuine. It goes beyond the realm of business. It represents a very deep commitment on our part to you, and of course for yours to the entire field. So thank you also. Now, the Nyswander Dole Award was created to recognize the outstanding contributions of individuals who have used their energy and skills to advance the cause of opioid maintenance treatment. As you will see, Dr. Nyswander and Dole were the first recipients of this award during the third annual New York State Methadone Conference of '83, and I had the pleasure of being there with them. So since that time, 250 individuals have received this award through the Northeast Regional Methadone Conferences and, of course, our subsequent national conferences. All of these individuals have been listed in the awards program this evening. At this time, it is our tradition to invite all of the Nyswander Dole Award recipients who are present to please stand and be recognized once again for all they have given to our entire field. Please, ladies and gentlemen. It is now my distinct pleasure to introduce Dr. Molly Carney, who has served as the Conference Award Committee Chair for 2019 and also serves as the Chair of the Washington State Association for the Treatment of Opioid Dependence, representing Washington State OTPs to the ATOD Board of Directors. Now Molly will present a special tribute dedicated to our colleagues who are no longer with us since we convened 18 months ago in New York. Molly will also review the method of selecting the Nyswander Dole Award recipients, in addition to introducing her committee members. So Molly, please, if you would. She has done terrific work with all of her award committees, and she will introduce them too.
Thank you, Mark. Good evening to everybody, and thank you all so much for joining us for this richly deserved recognition of outstanding colleagues in our field. Tonight, you will hear some incredible stories of hard work, compassion, and dedication to the people who we serve. Our hope is that you will be inspired and energized by the stories you hear. It's this kind of inspiration which helps each of us continue the hard work that we do in our field on a daily basis, helping people recover from opioid use disorders, helping stakeholders understand the incredible importance of MAT, of OTPs, and of the need for comprehensive care provided in office-based opioid treatment programs. We're going to, as Mark mentioned, we're going to start our banquet this evening by acknowledging the passing of some of our key colleagues since the last conference. Sadly, we have lost some major contributors to our industry, some titans in our field. This evening, we have 6 people to recognize in memoriam. The first person we are recognizing is Carmen Alt, who passed away in December of 2018. Carmen was the program director at Porter Stark Services OTP in Valparaiso, Indiana, for many years. She was a certified methadone advocate, a licensed clinical social worker, and a licensed clinical addictions counselor. Carmen began her career in substance use disorder treatment in 1971 and worked in Indiana's very first methadone clinic. In 1993, Carmen was named the president of the Methadone Advocacy Group of Indiana. She began her work at Porter Stark in the year 2000 as a member of the counseling staff and soon became director of the Chemical Dependency and Addictions Program. During this time, she was instrumental in lifting the methadone moratorium in Indiana and helped establish the Recovery Center. She was the director of the Recovery Center from 2008 to 2018. Carmen will be remembered for her advocacy on behalf of methadone patients, her deep caring and devotion to high clinical standards. A counselor who worked with Carmen noted, Carmen's greatest achievement was her enormous capacity to care in ways that patients not only noticed, but never forgot. Our second person to remember is Ricky Francillo, who passed away in April of 2018. Ricky began his career in the substance abuse and addiction treatment field as an entry-level counselor in 1976. He became actively involved in associations that advocate for people in recovery in multiple states, in Pennsylvania and Rhode Island in particular. In 1999, he joined the Pennsylvania Association for the Treatment of Opioid Dependence, PATOD, and in 2006, he became the president of PATOD. As chair of PATOD, Ricky was appointed to the Joint State Government Commission of the Distribution of Methadone and was invited to participate on the buprenorphine access work group. He also joined the work group that developed the recovery-oriented systems of care for OTPs. Ricky worked tirelessly to help educate elected officials about the facts of OTP services and the reality of patients with OUD. In 1996, Ricky started working with Discovery House and Smart Management in Rhode Island in one of his most important roles, which was patient ombudsman. One of his favorite sayings from recovery was, "You can't keep it unless you give it away." Ricky was an incredibly humble and gracious person. He always expressed how grateful he was of all the patients that have allowed me to give it away. They're the ones who deserve all the credit. Our third person this evening is Dr. Herman Joseph. Dr. Joseph had an immense impact on methadone research, evaluation, and treatment since the very inception of the treatment modality. He worked with Dr. Vincent Dole and the team at Rockefeller University in the 1960s, and in 1968, he co-authored with Dr. Dole the first article about methadone, which was written for the general public. Dr. Joseph also wrote one of the most extensive research papers on the long-term retention of patients in treatment following early studies at Rockefeller. He was a very early champion for the cause of eliminating stigma and increasing access to care in the criminal justice system. Before earning his graduate degree, Dr. Joseph was a probation officer in New York City. There, he was put in charge of the narcotics unit and went on to make the New York City probation office the first probation office in the country to be open to OTPs for people on probation. Dr. Joseph also had great influence on the development of the Rikers Island jail-based program, which provided MAT to the inmates in New York City jail, also one of the first of its kind in the country. At the request of ATOD President Mark Perino, Dr. Joseph co-authored a chapter entitled Historical Perspectives and Public Issues in 1993 for SAMHSA's first treatment improvement protocol. Dr. Joseph was a 1991 recipient of the Nyswander Dole Award during the association's first conference in March in Boston. He was one of the great early patient advocates, always arguing for compassionate and informed treatment of the patients that we serve. We are grateful for his contribution to our field. The fourth person for us to remember is Dr. Herbert Kleber, who passed away in October of 2018. A pioneer of addiction research and treatment, Dr. Kleber was professor of psychiatry and emeritus director of the Division of Substance Use Disorders at Columbia University College of Physicians and Surgeons and of the New York State Psychiatric Institute. Over the course of his 50-year career, Dr. Kleber and his colleagues probed the pathology of addiction and developed treatments to mitigate withdrawal and to promote recovery. This was unusual at the time because Dr. Kleber began his career, substance abuse was not a major focus of biomedical research and clinical medicine, so he forged a pathway into that academic pursuit. Dr. Kleber's research began with his military service when he was deployed to the U.S. federal prison in Lexington, Kentucky, the federal forerunner to the National Institute on Drug Abuse. At that time, that location was the primary locus for narcotic addiction treatment and research. There, he developed a clinical approach to treating inmates. This differed from the moralistic and social deviance context in which addiction was viewed at the time. When he completed his service and took a faculty position at Yale University. At Yale, he started the Substance Abuse Treatment Service at the Connecticut Mental Health Center and the Addiction Prevention and Treatment Foundation. Dr. Kleber's pioneering efforts were elevated to the policy level with his appointment as Deputy Director for Demand Reduction at the Office of National Drug Control Policy by the first President Bush. At ONDCP, he implemented policies that led to decreased demand for illegal drugs through programs of prevention, education, and treatment. He also co-founded, along with the former Health and Human Services Secretary, Joseph Califano, the National Policy Center on Addiction and Substance Abuse. Dr. Kleber was relentless in his pursuit of better treatments. Even up to the time of his death, he was pursuing improved strategies for inducting individuals with opioid use disorder onto MAT. Our fifth person this evening is Dr. Robert Newman, who passed away in August of 2018. In the 1970s, Dr. Newman was the Assistant Commissioner of Health for New York City, and he established that city's very first methadone program. He helped the city's treatment system dramatically expand into one of the most robust in the nation. In 1984, he opened one of the nation's first outpatient AIDS clinics while director of Beth Israel Medical Center. Dr. Newman, Dr. Newman was also an early advocate and a practitioner of harm reduction. At the forefront of the movement for drug policy reform, he was a staunch defender of the health and dignity of people who use drugs. For many years, he was a board member of the Drug Policy Alliance and effectively saved countless lives with his promotion and practice of harm reduction. As president and CEO of Beth Israel, Dr. Newman led the center through its most profound period of growth and expansion in the 80s and 90s. He was the founding president and CEO of Continuum Health Partners in 1997, which is the parent company for the partnership between Beth Israel, St. Luke's and Roosevelt Hospitals, Long Island College Hospital, and the New York Eye and Ear Infirmary. He retired as its president in 2001 and went on to be the founding director of the Baron Rothschild Chemical Dependency Institute at Beth Israel, a position he held from 2001 until his retirement in 2014. Tony Newman, who's the media director of the Drug Policy Alliance and Bob's nephew, said that his uncle's greatest compassion was helping people who struggled with drugs. His nephew noted that his uncle was simultaneously the leading advocate for methadone treatment in both the US and globally, and he was also the leading critic of methadone treatment. He was always pushing for the best possible treatment practices. Our sixth person is Dr. James Thomas Pate, who passed away in January of 2019. Dr. Pate was an early pioneer in the treatment of opioid use disorder with methadone. He was one of the very few individuals who, though he was never in medication-assisted treatment recovery himself, he was inducted as an honorary patient by NAMR Recovery. Dr. Pate received this honor because his commitment to patient issues rivaled advocates who were or are patients themselves. Dr. Pate left a legacy of great patient care. With ATOD, Dr. Pate helped organize the medical chapters for the first treatment improvement protocol from SAMHSA entitled State Methadone Treatment Guidelines in 1993. Dr. Pate also helped develop the curriculum for ATOD's original training course for clinicians. That course continues to this day and in fact occurred at this conference on Sunday. Dr. Pate wrote many influential articles throughout his career, including the seminal publication co-authored with Dr. Jones Zwiebin entitled Methadone Maintenance in the Treatment of Opioid Dependence, A Current Perspective. Clinically, Dr. Pate's teachings on peak and trough blood testing and on induction have been resources for many physicians and medical providers. At the time of Dr. Pate's passing, Zach Talbot, who is on the national board for NAMR Recovery and from whom you will hear shortly, was quoted as saying, "What has always impressed me about Dr. Pate and what will live on in my memories of him was his undying devotion to patients above all else. I continue to use his memo to staff from the early 2000s entitled, 'Bad Patients or Bad Treatments?' I use this memo with all of my staff, especially new hires. Dr. Pate reminds us that too often poor treatment outcomes are not the fault of the patient, but the fault of the provider for not giving the patient all the tools that they need to combat their illness." So we lost many significant people who have had an impact on our work since the last conference, and we remember them fondly. As we reflect on the major impact that these colleagues have had, it's now time to switch to this year's Nyswander Dole Award winners. The people we are honoring tonight are some of the current and future leaders in our field. The Nyswander Dole Award began in 1983 in recognition of extraordinary contribution to our field. The first recipients were Drs. Vincent Dole and Marie Nyswander, most of whom you know pioneered the science behind using methadone as a treatment for opioid use disorder. Each year, the Nyswander Dole Award is bestowed on individuals who have made extraordinary contributions to our field. It's our field's highest honor and is often viewed as the capstone of one's career. Tonight, we will be honoring 8 individuals who will be awarded this great honor. To help you understand the significance of this award, let me briefly explain how the recipients are selected. First, a notice gets distributed to the ATOD member states, the state opioid treatment authorities, and to our international colleagues in EuroPAD and the World Federation for the Treatment of Opioid Dependence, calling for nominations. Each state and EuroPAD can submit one nominee. The awards committee reviews the applications and provides a recommendation to the ATOD Board of Directors. It's the board that approves the final recipients. The minimum selection criteria for the award are: the state or country must have at least one OTP that's operated for at least 5 years. The nominee must be directly and consistently involved in the field of opioid maintenance treatment, either as a provider, a regulatory official, a researcher, or a patient. The nominee must have been actively engaged in one of these capacities in a nominating state or country for at least 5 years. They must have made meaningful and consistent contributions which have had a significant impact on opioid treatment in that state or country. And each nominee must have at least 2 letters of support delivered with the submission to the awards committee. This year, we're honored with 8 Nyswander Dole awardees. In a moment, you will hear their stories. But first, please take a moment to meet my fellow members of this year's awards committee. These individuals and I met to review all of the awards submissions and to provide the recommended awardees to the ATOD Board of Directors. Please stand when I call your name, and we will applaud them as the list is completed. First is Ann Jameson of Oklahoma. There she is. Jonathan Essenberg of Florida. Here he is. Chrissy Martin of South Carolina. And Michael Rizzi of Rhode Island. So thank you all so much for your service in tonight's event. As mentioned, this is a very special evening for our field. It's through celebration of the incredible hard work, dedication, and compassion shown in our field which keeps each of us inspired to continue fighting for our patients. Thus, I'm honored and humbled to help introduce to you all some of the very best colleagues that we have, and I congratulate each of tonight's award recipients. To get us started, I am very privileged to introduce our evening's award presenter, Dr. Icro Maremmani. Dr. Maremmani is a professor of addiction medicine at the University of Pisa and the University of Siena in Italy, and has been president of the European Opioid Addiction Treatment Association, or EuroPAD, since its founding in Switzerland in 1994. Dr. Maremmani is also president of the World Federation for the Treatment of Opioid Dependence. He has organized international symposia on OUD and on treatment all over the world, including several in collaboration with ATOD. In 1994, Dr. Maremmani himself received the Nyswander Dole Award and was the first non-American winner of that award. A long and dear friend of ATOD and a clear representative of the international collaboration needed on understanding and treating OUD, we are very honored to have him be our Nyswander Dole Awards presenter this evening. Please help me give him a very warm welcome.
Good evening. Thank you for this kind introduction. And when I attended the first time a Northeast Methadone Coalition Congress in Newport, Rhode Island in 1989, I never imagined that my life could be changed. At that time, I was an assistant professor of psychological medicine at the University of Pisa, Italy, and was involved in a service of liaison psychiatry. I was involved in methadone treatment only to support financially my residency in psychiatry. Detoxify patients with methadone was at that time mandatory in Italy, and as a result, patients' outcome was very poor. Richard Marx, an American friend visiting my city as a sculptor, but being the responsible for the New York State government for OTP's funding, explained to me the correct methodology, from detoxification to maintenance, using blocking dosages of methadone according to the Dole and Nyswander methodology. Richard invited me to visit the New York State methadone clinics, so I decided to visit the OTPs in New York, the Albert Einstein College of Medicine, Joyce Lowinson and Ira Marion as directors, and the Rockefeller University, where I met Vincent P. Dole. Like Paul of Tarsus, hit on the road to Damascus, I decided to become his disciple. I never had been against methadone at that time, but speaking with Vincent Dole opened my mind. Since that time, I changed my professional objectives, and I started dedicating all my professional time treating with methadone and buprenorphine my dual disorder patients at my university outpatient clinic dedicated to Vincent P. Dole, the Vincent P. Dole Dual Disorder Unit. So, I am extremely proud to be tonight with all of you, and, of course, sorry for my broken English. We will begin tonight by recognizing Mr. Howard Ashkin from Maryland. Mr. Ashkin has impacted the medication-assisted treatment MET assess viability, quality, and utilization, regionally and nationally. He has developed detoxification protocols for people who did not meet the accepted admission criteria for maintenance. These protocols allowed thousands to gain access to MET when many other OTPs adopted this protocol. In 2004, his OTPs were some of the first to start dispensing buprenorphine. Mr. Ashkin was able to gain coverage for this with Medicaid and commercial managed care organizations. In 2014, comprehensive buprenorphine services were at the risk of being cut from the payment benefit. Mr. Ashkin successfully intervened and gained the inclusion of the coverage in the state rates. As the chair of the Maryland State Association of OTP Providers, the association doubled in size and became a serious treatment, policy, legislative, and advocacy resource. Mr. Ashkin led the Maryland Association for the Treatment of Opioid Dependence efforts to improve Maryland precarious OTP rebundling plan, which resulted in improved availability, quality, and stability of OTP services statewide. Mr. Ashkin was an instrumental role in educating Maryland's Congressional Delegation for Medicare coverage of OTP's services, which resulted in Maryland co-sponsorship of the Bill for Medicare coverage of OTP services starting in 2020. In recognition of this impressive career, please help me congratulate Mr. Ashkin in his recognition as a Nyswander Dole Award winner.
Good evening, everyone. Good evening, Dr. Maremmani, Dr. Carney, Mark Perino, the awards committee, the ATOD board, conference attendees, and distinguished guests. I'm very honored and humbled to accept the 2019 Nyswander Dole Award for the very forward-thinking, consumer-focused, provider-friendly, Medicaid-expanded state of Maryland. I may appear to be standing here alone, but I am surrounded and supported by a lot of terrific people who I'd like to thank. I'm standing here this evening primarily because of one individual that I had the great fortune to meet around 40 years ago. In the middle of the night, early morning phone calls from emergency rooms seeking consultation for psychiatric evaluations that I performed. And I'm very grateful to Dr. Sheldon Glass. Glad that he could be here tonight. I'm forever grateful for our relationship arc from teacher to employer to mentor, colleague, and friend, not to mention our unique upstate New York connections. I'm also deeply appreciative of my employer, Medmark Treatment Centers and Baymark Health Services, especially Dave White, Jason Kletter, Frank Bauman, Robin Johnson, and Mary Lynn Logsden, who continually put patient outcomes and patient satisfaction first, and who support essential policy and advocacy work, and always lead by example of both words and actions. Thank you for helping me to educate, advocate, and collaborate with others to improve their understanding of addiction and the stigma, and reduce the stigma associated with this disease and its evidence-based treatments. I stand here with the Maryland Association for the Treatment of Opioid Dependence, better known as MATOD, the Baltimore City Substance Use Directorate, the Maryland Behavioral Coalition, Maryland DC ASAM chapter, Maryland's Amazing Behavioral Health Administration and Medicaid Division, and the 90+ Maryland OTPs who provide daily life-saving and compassionate services to our community of friends, relatives, neighbors, and others, the real reason that we're all gathered here. Special thanks have to go to Vicki Walters, my work spouse for many years, and Jackie Ashkin, my real spouse for almost 33. Time flies. They're proof if you're lucky enough to surround yourself with smart, strong, and caring clinical social workers, you may actually become a better person. Those of you who know me well enough also know that Jackie and Vicki deserve their own special awards. Lastly, before the music plays, a warm thank you to Dr. Joe Adams for his generous nomination and the 2019 ATOD Awards Committee for bestowing this great honor. I feel very privileged to join prior Maryland Award winners that include Vicki Walters, Dr. Ken Stoller, Dr. Ingvild Olsen, Jim Graham, Dr. Robert Schwartz, and many others. I thank you very much.
The next awardee is Marc Auriacombe from France. Dr. Auriacombe is a professor of psychiatry and addiction medicine at the University of Bordeaux, France. He is the principal senior investigator of an integrated addiction research program funded by French national and European funds. Dr. Auriacombe's group started using opioid agonist maintenance treatments for heroin addiction in the mid-1980s, and they have some of the most extensive clinical experience with opioid agonist treatments in France. Dr. Auriacombe's research focus has been on the commonalities across addictive behaviors, and he has published more than 200 scientific papers on this topic. Dr. Auriacombe has made significant contributions with innovative thinking. As a result, his research has directly countered a lot of dogmatism, polarization, and resistance to new concepts that are all too common in our field. In both depth and in breadth, his academic and scientific contributions are extraordinary. His research has been of major importance, particularly on craving, individualized precursor to relapse, and related comorbidities in the drug use disordered population. In recognition of his significant contributions to our field, please help me congratulate Dr. Auriacombe in his recognition as a Nyswander Dole Award winner.
I just have 3 minutes, so I really need to take my time. I'm thrilled, I'm very happy, very overwhelmed to have my name so closely affiliated to Vincent P. Dole and Mary Nyswander is absolutely overwhelming. It's serious. It's very serious, and I feel happy, but now lots of pressure to keep up to the award. I want to thank many people. I want to thank Icro Maremmani, of course, and Europad. I know I owe very much to Icro Maremmani and Europad. As a senior person, he has been a mentor, and now he's a friend, and I'm very happy about that. I want to thank also, of course, the other Mark, with a K, funny enough, Mark Perino and Todd and all the organization for giving me this award. I want to also acknowledge those that introduced me to the field of addiction in Bordeaux, Jean Tignol and Jean-Pierre Dole, that in turn introduced me to people that were very important for my career, Chuck O'Brien in Philadelphia and Mary Jean Creek. I want to salute previous awardees from Philadelphia. And I also want to acknowledge my team, both the clinical team at the hospital in Bordeaux with the doctors, nurses, counselors, and so forth, and the research team that has helped me to do all this research and contribute to get data to contribute to destigmatize and empower our patients. Before last but not least, I want to, I was going to say thank my wife and 2 daughters. Actually, I should excuse myself to my wife and daughters for all the stress I have shared with them. And it's unfortunate they could not come, but I will be seeing them tomorrow and as they're coming to Philadelphia. And now, last but not least, of course, I want to thank the patients, their families and friends that have helped me to help them by collaborating to my offer of treatment and the requirements of treatment, but also for their contribution to research and giving their support to the research. Thank you very much.
The next awardee is John Brooklyn from Vermont. If you have ever heard on the Vermont hub and spoke model for the integrated treatment of opioid use disorder in primary care, then you need no introduction to Dr. John Brooklyn. Dr. Brooklyn is the key architect of this program. Dr. Brooklyn's career in substance use disorder began during his family medicine residency in Vermont. Inspired by his professors, Dr. Brooklyn was unafraid of a substance use disorder when he began his family medicine residency in Vermont. He followed his residency with employment at University of Vermont Substance Abuse Treatment Center, and he has been involved in every buprenorphine research study at that facility since 1992. In 2000, he helped start the nationally recognized Children and Recovering Mothers Group to coordinate care of pregnant opioid users and their babies and the promotion of intact families. Dr. Brooklyn helped open Vermont's first OTP, and in 2003 was one of the first physicians nationwide to prescribe buprenorphine. It was while he was driving long distances between rural OTPs that he conceived of the Vermont hub and spoke model for integrating opioid use disorder treatment into primary care. This model stands tall in one of the most effective service delivery models for opioid use disorder, particularly in rural areas. Dr. Brooklyn has also been key in establishing opioid use disorder treatment in Vermont prisons, works on technology solutions to expand access to care, and has mentored many in the field. Please help me congratulate Dr. Brooklyn on his accomplishments and in his recognition as a Nyswander Dole Award winner.
I haven't even started talking yet. The music's going off. Good evening, everyone. I don't know about you, but I get a lot of robocalls lately and have stopped answering my phone if I don't recognize the number, right? So when I got a second call from the same number, I thought, okay, I'll answer it. You know, late in the day, and you're kind of worn down. A very chipper voice on the other end says, "Is this Dr. Brooklyn? This is Molly from ATOD." And I thought, oh, brother. Probably asking for money, although I'm pretty sure that's in the cards for next year. That's okay. Anyway, she tells me I've won this award, and tears came to my eye. I was really overwhelmed and probably about to become overwhelmed again. So I want to thank you to Mark Perino, the nominating committee, the ATOD board, and the colleagues who nominated me and have worked with me: Dana Poverman, Tony Fallon, Jason Gogan, Jason Kletter, Ken Stoller, and all the others to make opioid treatment available in Vermont. Thank you to my medical school mentors at Brown University, Drs. Alan Wartenberg and David Lewis, who made me unafraid to treat opiate use disorder like any other chronic medical disease. And thank you to Dr. Maremmani for your wisdom over the years and for giving me the opportunity to say when I'm commenting on treatment, you know, the Italians have shown. I'm also incredibly grateful that my two daughters, Chelsea and Amanda, my son Rashi, and my life partner, Kara Hart, were able to attend this event. And finally, congratulations to my fellow awardees. In 2003, my very first buprenorphine patient was a wiry 38-year-old IV heroin user who came in with his mom. He had a 25-year history of injecting, had been in and out of jail, and worked as a roofer. Ever since that day, he has never had a positive urine drug screen for opioids. One day I said to him, "Hey, does it get to be a burden after a while to every day take this medication, put it under your tongue, wait 5 minutes? And did he ever get tired of it because of the commitment, you know?" He said, "Doc, you have no idea. All I've got to do is remember all the people I ripped off, all the running I did, and all the things and how sick I was to get drugs. This is a blessing." So I now see him about 4 to 6 times a year, and he currently works for a local towing company. So about 2 months ago, my car got towed one evening. And we had to go to a sketchy part of town to pick up the car. So obviously I didn't get a receipt that day. So the next day, being Saturday, I went down to the towing office and I walked in, and Scott, my patient, was there. I walked in and all 6'2", 250-pound burly tattooed guy jumps up and says, "Doc, I am so sorry your car got towed. If I had known it was you, I never would have let them do it. Hey everybody, this is my doctor. He saved my life. Doc, we'll never tow you again." pride, gratitude, no stigma, no shame. Thank you. Buonasera, bonsoir.
The next awardee is Rochelle Head Danam from Louisiana. Dr. Ed Danam is the Executive and Medical Director for Metropolitan Human Services District in New Orleans, which oversees services for persons suffering from mental illness, substance use disorders, and intellectual developmental disabilities. She holds academic appointments at both the Tulane University and the Louisiana State University Schools of Medicine. When Dr. Head Danam was the Assistant Secretary and the Medical Director of the Louisiana Office of Behavioral Health, she initiated the legislation which finally ended a 10-year moratorium on new OTPs in Louisiana. Dr. Head Danam helped establish criteria for the determination of need in underserved areas of the state, which allowed new OTPs to validate their treatment needs. At the same time, Dr. Ed Danam developed OTP application standards to make sure new programs would provide excellent care. As a result, the number of OTP expanded by 25% in the state, bringing care to patients and the communities desperately in need. Dr. Ed Danam has been active in training healthcare providers and law enforcement throughout the state about opioid use disorder, and has a significant impact in the dignity and respect with which the Louisiana state system provides care to people with opioid use disorder. Please join me in expressing our gratitude to Dr. Head Danam for all she has done and in her recognition as a Nyswander Dole Award.
I like that music. It was nice. Hello, everybody. It's really good to be here tonight. And I have to tell you, I'm not used to getting awards because typically my head is buried in the work. And then you wake up one day and people have put your name on a roster and has asked people to notice you. Well, you know, it's nice, but in truth, I really, really love doing the work. Let me tell you something. When I first went to medical school, I had no idea I would be a psychiatrist. Then I became a psychiatrist, and I had no idea that I would be doing addiction psychiatry. Then I did addiction psychiatry, and I had no idea that someday I would be recognized as a crusader for opioid treatment. How about that? So we've done a lot of work in the state of Louisiana, lifted moratoriums, introduced managed care, and expanded Medicaid, all of which has been critical to making sure that people with substance use disorders are given the parity they need to receive the assistance that they need. And the opioid crisis just falls right in line with us being able to take care of that specific disease pathology alone. I have to tell you that I owe everything to God at the end of the day, because in truth, it is He who really orders my steps. And I am a church girl, yes I am, and I know some scripture and all, but in truth, I live the word and I give honor where honor is due. I also give honor to my family, my mom, who was just a great inspiration to me, but the people I've worked with. Tracy Perry and I sat at that table alone like we had a table full of people because we are connected in such a way that our relationship allows us to do this work consistently and on and on and on. So I'm very thankful to all the people that God has placed in my life to do this work. I have not done this alone. I've stood on the shoulders of some very great people. And I say thank you to all of them, and I say thank you to all of you who took the time tonight to come out and honor us. To you, I say we honor you as well for the work that you're doing. So thank you so much, and thank you to the ATOD board tonight.
The next awardee is Steve Mollart from California. Mr. Mollart helped establish Aegis Treatment Centers, one of the nation's largest OTP provider system in California. As the Aegis Chief Financial Officer and Vice President, he became an impassioned advocate for MET with the county and the state government. By collaborating with the patients' advocacy groups, Mr. Mollart gave patients a voice in drafting policy into legislation. Mr. Mollart has tirelessly advocated for MAT patients with the California State Legislature and for bills that raise the standard for accreditation and certification of OTPs, for supporting patients' rights, and for improving treatment accessibility. In 2010, Mr. Mollart was instrumental in working with the Patients Advisory and Advocacy Group in reversing the governor's effort to completely remove OTP services from the state Medicaid system. By averting this potential calamity, he helped save payment for and therefore delivery of OTP services in California. As a result of all his work, California has seen enormous positive change in community acceptance of OTPs. Please join me in recognizing Mr. Mollart for all he has done on behalf of our patients and in his recognition as a Nyswander Dole Award winner.
Well, good evening. I was a little bit embarrassed when I got told that I got this award, because I really don't provide patient services, but I guess that it's sort of meant to be. I had an older brother and a younger brother who both struggled with drugs. They both died well before their time. But during the period when they were alive, I was the trustee of their trust. And if you want to really stress the relationship between brothers, just control their money. But a friend of mine who I golfed with, a physician, and I really didn't know what kind of medicine he practiced, we would be on the golf course, and he knew that I was having this issue with my brothers. So he would explain things to me, an article that he'd read or something, and what it meant, and the brain science and all that. And I must tell you that I was in that camp of, this is really a moral failing, this is just weakness, they just need to stop. but that's changed a lot over the years. This is sort of my fourth career. I was with the Big 8 CPA firm for 10 years. Ran the financial department of an oil company for 8 years. I was sort of in semi-retirement and doing consulting, and this doctor friend said, I'd like you to help a friend of mine who's looking at this chain of clinics to purchase and help him kind of do the financial evaluation. So I committed to a 3-month consulting arrangement. That was about 21 years ago. And over the years, I've attended, I think, 12 ATOD conferences, 11 or 12. And I always learned so much coming to this and watching what all you folks do. And it just makes me feel good. So I don't really do it for the money. I do it because I love doing it. It was mentioned that we had a fight with Schwarzenegger when he tried to eliminate the benefit. I must tell you that I can't take credit for all of that. I mean, we had patients who were in our patient advocacy group that went up to Sacramento and testified and did press conferences. The comp board did a special assessment of our members and hired a PR firm. We got the sheriff of Los Angeles and the police chief of Los Angeles to hold a press conference and tell Schwarzenegger that he was nuts. If he did this, you know, the streets would be full of people that were being discharged from these treatment programs. One thing that wasn't talked about is a recent thing that I did that just was out of frustration is the Waiting Lives Matter t-shirts. And anybody wants to copy that, please feel free. We had a county that just wouldn't let us expand. But I'd like to thank the board, Mark. I'd like to thank the 700 plus people at Aegis who treat more than 10,000 people a day. They get up in the middle of the night, come to work, and do a wonderful job. And I'd like to thank all of you because you're the ones that are saving the lives of these people and giving them the ability to reconstruct their lives. Thank you.
The next awardee is Miss Tracy Nicolosi from Massachusetts. Miss Nicolosi has devoted her career to reducing barriers and improving the quality of OTP care across New England as she has worked her way from line staff to executive. Early on, Ms. Nicolosi helped develop protocols for detox and acute care facilities to make a direct admission to OTPs. She had a significant impact on reducing the stigma of opioid use disorder in the regional medical community. This was done through training hospital maternity departments in best practices for pregnant women and newborns, integrating medical residents within the OTP and providing training to medical staff regionally. Ms. Nicolosi became a regional director with ABT OPCO and then assumed oversight of OTPs in Massachusetts, New Hampshire, and Vermont, and was charged with establishing one of the first hubs in the Vermont Hub and Spoke program. Ms. Nicolosi then became a state regional director with the Beacon Health Options, overseeing all levels of substance use disorder care, and then became the Massachusetts State Opioid Treatment Authority. She is now Vice President of Addiction Treatment Services for Lehigh Health Behavioral Services and focused on using telelearning to share best practices for opioid use disorder. Ms. Nicolosi's work has helped improve the quality of mental health and substance use disorder services for adults and children throughout the region. For her hard work and dedication, please help me congratulate Ms. Nicolosi on her recognition as a Nyswander Dole Award winner.
Thank goodness I wore my heels. So the last time I had to get up and speak in front of, actually I've never had to get up and speak in front of 700 people, so good for me. So the last time I spoke in front of such an esteemed group of colleagues was when I was at the Massachusetts Bureau of Substance Addiction Services, and I was facilitating a Bridging the Gap forum. And in attendance were Dr. Monica Burrell, who was the commissioner of the, still is the commissioner of the Department of Public Health, the then director of the Bureau of Substance Addiction Services, and my current boss, Hillary Jacobs, was in attendance as well. So what I was supposed to say was I'd like to thank all of our attendees and our speakers for joining us this evening, and instead what I said was I'd like to spank all of our attendees. So once I say that, I feel a little bit easier. So I'm really, truly humbled and honored to be part of such an esteemed group of folks that are up here talking about the work that they do. It's really odd for me to be recognized for work that I love to do. It feels very strange to be able to do that. I have a lot of people to thank, but the people that I primarily want to thank are my patients, because my patients over the past 23 years, yes, I'm 50 years old, everybody knows what it means when you turn 50. Everything that I know, everything I think I know, everything that I will eventually know is from my patients. My patients have taught me to listen. They've taught me to tolerate their pain. They've taught me to tolerate my pain, to tolerate silence, and to help me understand that for the people that we serve, there's a consequence to telling the truth. And at some point in the near future, I hope to be able to come back here today with all of you and be able to say there no longer is a tolerance for our, a consequence for our patients to be able to tell the truth in the fact that they are suffering from this disease and that they need assistance and that there isn't a consequence for them basically being who they are. Thank you very much.
The next awardee is Mr. Alan Oberman from New Jersey. Mr. Oberman has spearheaded many significant innovations in the New Jersey and surrounding regions, for which he is recognized tonight. In 2005, Mr. Oberman integrated methadone into all programs in a comprehensive addiction recovery center. This was at the time when methadone was typically prohibited from addiction recovery centers. Mr. Oberman helped launch the state's first mobile OTP units and helped relocate two aged OTPs and replace them with the state-of-the-art facilities. Then, in 2012, Hurricane Sandy hit New Jersey. No amount of pre-planning could have prepared the state's OTPs. One of Mr. Oberman's OTPs was located in coastal Atlantic City, was forced to evacuate and close for 6 days. Mr. Oberman worked with local OTPs and emergency management personnel to transport and medicate over 600 patients. Incredibly, not a single patient relapsed during this time. In 2017, Mr. Oberman opened the state's first licensed meth program in a jail using a repurposed bus. This program now serves as a statewide model for other jails. Currently, Mr. Oberman is a fierce advocate for the free distribution of naloxone. He is committed colleague to his OTP peers, elected officials, and other stakeholders in the region. Please join me in expressing our gratitude to Mr. Oberman for all he has done and in his recognition as a Nyswander Dole Award winner.
I wish I had that waterfall falling into my mouth now. I'm so nervous. This is cute, huh? So first of all, I want to thank and acknowledge a few people, mostly groups because I don't remember people's names. But one, I want to acknowledge the consistent, quiet, effective leadership of Mark Perino. You know, we're sort of in the forefront now that there's an opioid epidemic, but how many years were we on the fringes? You know? I also want to really thank the collegial supportive relationships of the New Jersey ATOD, and somehow in a moment of insanity, they nominated me. And then the board also saw fit to confirm that, and when they told me all this, I just couldn't believe it. But, so thank you. I don't even know what I'm doing here, but thank you very much. You know, I've been at a number of these kinds of banquets and would see the person who stands up and, you know, in front and gets these different awards and everything, and be somewhat in awe. And I'm really no different than many of you, or if not most of the people sitting at the tables right here, right now. Probably the biggest difference between me and most of you is my age. I came to John Brooks Recovery Center, which is located in Atlantic City, about 15 years ago. It was in a tough spot, and I had a vision. I wanted to create a comprehensive substance abuse treatment center that integrated MAT in all levels of care, that would be of the quality that I would be willing to recommend a family member to go to. And that was my standard of care. This April, God willing, we'll finish up our new inpatient facility, and that'll lead me towards retirement. And I feel very comfortable that I've completed that vision. It's taken 12 years, but I feel good with it. And there isn't anything that I've been able to accomplish at John Brooks without the staff. A number of them have come here. They allow me to lead. Without them, there's no leadership. Nothing gets accomplished. And those of you in the room, you all know this. You've heard it from the other presenters. You know, this is how it works. I want to read you a quote from Teddy Roosevelt. So this is on my refrigerator. It's something that I draw strength from. I draw some sense of identity from. and it resonates with me. There are times when I've read this and think about it, I've grown emotional, so you might have to bear with me. And I hope this resonates with many of you, if not all of you. It is not the critic who counts, not the person who points out how the strong one stumbles, or where the doer of deeds could have done them better. The credit belongs to the one who is actually in the arena, whose face is marred by dust and sweat and blood, who comes short again and again, because there is no effort without error and shortcoming, but who actually strives to do the deeds, who knows the great enthusiasms, the great devotion, who spends oneself in a worthy cause, who at the best knows in the end the triumph of high achievement, and who at the worst, if fails, at least fails while daring greatly, so that their place shall never be with those cold and timid souls who neither know victory nor defeat. Thank you.
The latest awardee is Miss Lauren Simbab from Connecticut. As the Opioid Services Coordinator and the State Opioid Treatment Authority in Connecticut, Ms. Simbab was instrumental in expanding methadone treatment in Connecticut correctional system, had helped create 5 methadone programs at 5 correctional facilities. These programs are now a prototype for providing methadone treatment to everyone in the state correctional system who needs it. Mrs. Simbab has also been instrumental in expanding meth statewide so that treatment access is available regardless of insurance coverage. She has ensured that all OTPs now have a meth-specific recovery coach on staff, and that on-call recovery coaches are now in 13 hospital emergency departments for use when an overdose is admitted. Ms. Simbab has launched several initiatives to reduce stigma and misinformation about meth for professional and lay persons. She brought together OTP clinical directors across the state through a series of methadone roundtable meetings. Not only has this helped collaboration across OTPs, but it has ensured consistent adoption of best practices. Ms. Simbab has served as a fierce advocate and collaborator for quality meth services across the state, and for this we congratulate her on being a Nyswander Dole Award winning.
Good evening. This is incredibly nerve-wracking. So thank you to ATOD and thank you to all of you. Even though I'll be going home with the pin and this award, this is something that's really been earned by the entire Connecticut team that does the work each and every day in the state of Connecticut. I'm talking about the leadership and the staff of the 29 methadone clinics and 5 of our correctional centers in Connecticut. So I'd like to recognize the individuals that have inspired me, that have supported me over the last 20 years, including the Connecticut Methadone directors that nominated me for this award, the present directors, Rico Belangi and Paul McLaughlin, previous directors. And I'd like to thank Dr. Kathy Maurer for her friendship and her support. Dr. Maurer has single-handedly transformed the treatment system in the state of Connecticut for people with opioid use disorders by bringing medication-assisted treatment into our correctional facilities. Dr. Thomas Kirk, who was one of the early champions of recovery-oriented systems of care. I'd like to thank my colleagues at NASDAD and all of my SOTA friends and colleagues around the country. I'd like to thank my staff and my colleagues at my agency and my family, my daughters. Last but not least, I want to thank the people that fight this fight each and every day, one day at a time. I am so humbled and so honored to be working with them. They are making this work so incredibly rewarding for me. Thank you very much.
Bravo, Icro. Bravo. And bravo to all the Nyswander Dole Award winners, too. So, before we move on to the Patient Advocate Award, I would like to acknowledge the work of two remarkable people. First, Mary Jean Creek, who was at Rockefeller at the very beginning as part of the original research team. Also, the work of Dr. Loretta Finnegan with the Finnegan Scale, whose passion in treating pregnant women and their families is remarkable. So to the Patient Advocate Award. Richard Lane was a former long-time heroin user who, upon release from prison in 1967, was instrumental in establishing one of the nation's first methadone treatment programs. In 1974, he became the executive director of Man Alive and later served as the vice president of the American Methadone Treatment Association, now ATOD, and as vice chairman of the Governor's Council on Alcohol and Drug Abuse in Maryland. Richard was a passionate advocate for methadone treatment and provided inspiration to patients and colleagues alike. Robert Holden was also a recovering heroin user who later became the director of PIDARC, an outpatient methadone treatment program in the District of Columbia. He later served as the vice president of the American Association for the Treatment Association, succeeding Richard Lane's term of office. It is extremely fitting that this award was named after both gentlemen, since Richard Lane was Robert Holden's counselor when he was admitted to treatment. This award certainly keeps their memories and their achievements alive. This award was established in 1995 and recognizes extraordinary achievements in patient advocacy. The ATOD Board of Directors and the Awards Committee turned to the National Alliance for Medication-Assisted Recovery to work with other recognized patient advocacy organizations to nominate the award recipient. It is my pleasure to introduce Joycelyn Woods and Paul Bowman, who will provide this award to Zachary Talbert. It is also fitting that Joycelyn and Paul are providing this award since Joycelyn was the recipient of the first Patient Advocacy Award, and Paul was the most recent recipient when we convened in New York during 2018. I know that Joycelyn and Paul will describe the process of selecting the awardee and will explain why Zach is being so recognized. Now, I've known Zach for many years, and we are very pleased that his advocacy is being properly recognized this evening. So, to Joycelyn and Paul, please.
Every year, when the award is announced, the following criteria should be met. Only one nominee can be submitted to the Conference Awards Committee. There may be a number of nominees, but only one consensus nominee may receive the honor. This nominee may have been involved in the field of methadone or MAT advocacy for a period of 5 years. The nominee must have made meaningful and consistent contributions which have had a significant impact on opioid treatment within a state or region of the United States. For each nominee, a nomination form must be completed and submitted with 2 letters of support. Now, NAMA Recovery is responsible for collecting all the submissions and selecting a committee that consists of the last 3 awardees and them and another additional advocates, making 6 of the committee decide the final candidate. And at that point, we send it to the awards committee. Now, the last nominee in New York and the recipient was Paul Bowman, our Boston chapter. And one of the things that we have decided to do is to have each last nominee handed off to the next nominee. So he will give it to Zach.
Hi, everybody. I'm so privileged to be able to give this to Zach. I've had 18 months of being the award holder, and it's been quite an interesting challenge. And I got to do 60 minutes and a whole bunch of different stuff. But I mean, I was saying to Zach, can I come up here and make some jokes? And he's like, don't embarrass me. But I'm like so happy when Zach joined NAMA because he was much more of a pain in the ass than I ever was as an advocate. So when people called, they'd say, was it Paul Bowman or that guy from the South? And if it was the guy from the South, they were happier. Anyway, I'm so happy to give this to Zach. Happy to announce that Zach is NAMA's new president-elect. So let's give him up for that, too. And just wanted to say a thank you to Zach, because it's the new people that we bring into this that give us a run for our money and make us better people and advocates. Congratulations, Zach.
The weight of the legacy left by Richard Lane and Bob Holden is not lost on me tonight. Individuals who are living in long-term sustained recovery from opioid use disorder encounter stigma, the likes of which is difficult to put into words, and it exists even within our industry. The first time I set out to open and operate an opioid treatment program, I was told by many people that individuals whose recovery was facilitated by medication-assisted treatment can't, shouldn't, or would never accomplish such a task. But individuals living in recovery are resilient. And like Richard Lane and Bob Holden, I did what I set out to do. Never forget that many of the original staff of Dr. Dole's programs were individuals in medication-assisted recovery. Never forget that the individuals who opened and then directed some of the earliest OTPs in the country were individuals in medication-supported recovery. Individuals like Richard Lane and Bob Holden, who both also came to serve alongside Mark as vice presidents of this very association. But despite the stigma and prejudice, there are many people who have supported me. I owe a debt of gratitude for the support I continue to receive from my partner Chip, from my sister Leslie, Joycelyn Woods, Walter Ginter, Stacy Pierce, Allie McCorkle, Sharon Larson, formerly Dembinski, Amy Morris, Claudette Thor, Debbie Crowley, Vicki Friel, Dana Johnson, Dr. Alan Wartenberg, Mark Perino, and many others that I see present tonight. And to Dr. Mary Jean Creek, thank you for the research and work you did alongside Drs. Dole and Nyswander, and for always reminding the field that the love and care of patients, not EBITDA or balance sheets alone, must drive everything we do. I am alive, free, thriving, and able to receive this award tonight because of your work. And in memory of those whose legacies and lessons still shape me, Carmen Pierman-Arlt, Dr. Bob Newman, Dr. J.T. Pate, and Dr. Herman Joseph, may their memory be eternal. And lastly, I must end by urging everyone in this room to push back against efforts to obliterate the core confidentiality protections of 42 CFR Part 2. The public commenting period ends this Friday, October the 25th. Commenting guides and directions are available on the Legal Action Center's website or NAMA's Facebook page. Stigma is alive and well, and individuals with substance use disorders continue to be criminalized across the United States. Until this changes, we must rally to defend and protect the core protections and original intent of 42 CFR Part 2. Thank you.
Thank you. Thank you all. So now we go to the last award, and this is the Friend of the Field Award. And this was established by the Board of Directors of the American Association for the Treatment of Opioid Dependence, and it was prepared for the 1988 conference in New York. The Legal Action Center was the first recipient of this award, and its president, Paul Samuels, is here this evening. Paul, where are you? I think he's somewhere out there. This award recognizes extraordinary contributions to the field of opioid addiction treatment by an individual whose work, although not directly related to the provision of opioid treatment services, had a significant impact on our field. Now, the Friend of the Field Award recipient must be approved by the Conference Awards Committee and the ATOD Board of Directors. The 2019 Friend of the Field is being given to Dr. Gilberto Guerra. As you may know, Dr. Guerra currently serves as the Chief of Drug Prevention and Health Branch, the Division for Operations in the United Nations Office on Drugs and Crime. Dr. Guerra has held this critical position since 2007. He received his medical degree at the University of Parma in 1981 and his specialties in internal medicine and endocrinology. He has devoted his entire professional career to the practice, policy, and research in addiction medicine, in addition to fighting stigma and the discrimination for individuals affected by opioid use disorder. He has also explored the conditions of the psychological vulnerability among children and adolescents. Dr. Guerra has worked closely with the American Association for the Treatment of Opioid Dependence over the course of many years in conjunction with our associates in the World Federation for the Treatment of Opioid Use Disorder. His leadership has improved access to treatment and the quality of care for opioid disorder throughout the world, most especially given his work at the United Nations Office on Drugs and Crime, and he has transformed that office since he has been there. He has worked tirelessly on behalf of so many patients and their families to ensure that the member nations of the UN understand the urgent need to treat opioid use disorder with all of the tools at our disposal. Dr. Guerra is truly a great friend of the field, and we are honored to make this presentation. While unfortunately, Dr. Guerra could not join us this evening, and accepting this award on his behalf will be his very close friend and associate, Icro Maremmani. But first, some remarks from our Friend of the Field Award recipient.
Good morning to everyone. First, I have no words to describe my gratitude to the American Association of Treatment of Opioid Dependence, particularly the board members of ATOD, the President Mark Parrino, and our friend Icro Maremmani. Let me also express my sincere regret because I am not able to be there in person. I am deeply touched by your recognition of my life work in addiction medicine, including work in clinical practice, research, and policy. I perceive this award as something to be shared, It is not for me solely, not for me alone, but rather it is to be shared with my UNODC team in Vienna, the United Nations Office on Drugs and Crime, my colleagues in the World Health Organization in Geneva, the Mental Health Department of WHO, and all the courageous and dedicated colleagues providing daily care and support to people affected by substance use disorders. I would like to recognize also the patient and their families, not to give up in the recovery process, in the difficult recovery process, and they are daily inspiring us to persevere in this work, so serious work. I started more than 30 years ago with a motto, an aim in my professional scenario, using the words nothing less than is expected for any other chronic disease. When we see in WHO joint program from drug dependence treatment and care is exactly saying this, nothing less than what is expected for any other chronic disease. It was so sad, I was so sad to see the people affected by substance use disorder not recognized as medical patients, but rather stigmatized, criminalized, and marginalized in both high and low-income countries. We have created in Vienna and in Geneva a bridge between science and policy, science and clinical practice, facilitating a process among member states that culminated with the United Nations General Assembly Special Session on Drugs, the outcome document of 2016, a very advanced, comprehensive, science-based policy document. Member states formally and unanimously recognized drug dependence as a multifactorial health disorder, a multifactorial complex health disorder, not a crime, not a moral failure, not a recreational activity, not a social trend. Substance use disorders are preventable and treatable health conditions with a specific pathogenesis. We have reached in the last 12 years more than 50 countries to qualify professionals in addiction medicine and counteract the misleading views of addiction, such as it is a result of a free choice, it is simply a moral failure, it is a self-acquired disease. Because of this global shift in perspective, member states started to move from the sanction-oriented approach, the punitive approach, to the healthcare and social protection approach. We moved from the unnecessary conflict between harm reduction and demand reduction to design a continuum of care oriented to recovery, responding to the specific needs of the person affected in the different stages of the disease. We moved from the intervention carried out in isolation to the approach integrating psychosocial and pharmacological methods with personalized and differentiated strategies. Over many years of clinical practice, my patients have taught me that recovery is possible in the most difficult conditions. We need to accompany the people affected through their innumerable failures, not only through their success. The challenges of ups and downs do not diminish the value of the person. The person remains an unconditional value. Each person counts was the motto adopted by the Commission on Narcotic Drugs some years ago. Each person counts. Let me conclude by making an appeal for more multidisciplinary research which will permit to explore new ways to prevent relapse and consolidate the recovery process. My final thoughts are dedicated to the persons who have lost their life in the overdose epidemic. Most of them experience this level of suffering that was unimaginable and sadly not expressed or not considered by the community. Each overdose represents a story of hidden suffering and non-existing responses. I hope that with the invaluable contribution of scientific associations such as ATOD, we will be able to extend the healthcare coverage for substance use disorder all around the world to provide innovative, qualified and accessible services, particularly for the poor. It is critical that we remember our patients need to recover the amount of love they have been deprived during their life, mainly during their childhood and adolescence. So at this point, today we are here to provide this love. They need our love. Again, many thanks for your consideration of my work, for this award, and for your continued support.
So, accepting this award on Dr. Gueda's behalf, his very close friend and associate, and certainly my partner in international policy, Icro Maremmani.
Thank you, Mark. I collaborated a long time in Italy with Gilberto before he went to United Nations in Vienna. Gilberto changed the division of the United Nations Office of Drug and Crime, UNODC, from a police-controlled system to a therapeutic one. We are collaborating still now to spread the concept of addiction as a normal illness worldwide. I am sure that he would be very glad to be here and receive in person this important award, and I thank you on his behalf. Thank you.
So, in closing, thank you for being here, celebrating these accomplishments of such remarkable people, as you have heard. I thank the entire Mallinckrodt team for their continued support, and we have much work ahead. And for our musical entertainment, you should know how much people enjoyed the music, and the day is here, talked about how great you were, so thank you as well. Our pleasure, thank you. And to thank, once again, David Nisi, all of the people on the STAIS, their committee members, for all of their work, for my staff at ATOD, for Carlene Maxwell-Taylor, Angelina Budia, and Sabrina, who's not here, to Maria Ramos, to Heather, to Emily, to all of our associates at Tally Management who've been working with us for well over 20 years. And so I remind you again that you have flowers at the table. You are welcome to take them with you back to your room or wherever you happen to be going. And how you decide that clearly is on your own behalf. If you can't figure that out, I don't think I could be of much help to you, frankly. So thanks once again. Have a good evening. Thank you for being here.